As you are aware, we have done our maiden bariatric surgery, which is one of the things that are making Kenyans go to other countries, specifically India, South Africa, to reduce obesity. We know as Kenyans are living more sedentary lives. More Kenyans are getting diabetes, they are getting obese, they are getting hypertensive, and some are actually getting sizes that they can hardly control. So this was one of our cases, and I'm proud to say that we had a team of doctors, anesthetists, nurses who actually did this work, led by my able man here and my classmate, Dr. Kennedy Mulehane Odede and Dr. Darao here. These are the team, they were the lead surgeons, and we are happy to say that today we are discharging the patient, and we are happy to say that now we can do it in less than a third of what people pay out there. So we are happy, and we are very happy also that the ministry has been instrumental in this process. To tell you categorically, even the PS came to visit that patient. So we are happy that most of the activities now, as we prepare to help Wanjiko who have such things, we are saying that Kenyatta National Hospital is equipped to handle these even subspecialty levels. And as you tell Kenyans out there, we are willing and more than willing to go an extra mile to make sure every Kenyan enjoy their freedom of being healthy in the spirit of universal health coverage. Thank you very much for coming. I will let the surgeon to tell you now what and how they did it.
Of hosting you here today, and like Siwa said, this is a feat we are happy with, because little goes noticed about these problems we are talking about, the non-communicable diseases that are killing, unfortunately, a very high percent of the population. In the world over, it's estimated that 71% of the population is dying from non-communicable diseases, NCDs. And as it were, Kenya, we are not exempt. The sedentary life we live, the foods we are eating these days are now predisposing us to the same problems we have been talking about. Western diets, Western lifestyles, they are here. Truth be said, more than 15% of Kenyans are actually suffering from obesity, 15%. And truth also be said, more than 50 operations have been done every year in this country. We are talking about the same operation. More than 50 are done in this country per year, and more than 100 Kenyans travel abroad every year for these surgeries. So why do we become special in this occasion? Why we become special and why we see ourselves special is because the cost of doing bariatric surgery out there is anywhere close to 1.5 million Kenya shillings. How many Kenyans can afford 1.5 million Kenya shillings? Very few of us. And we're saying, as a public hospital, we have been able to achieve this. And actually the costs, if we look at the costs of the materials, the theater, the ICU, everything we used is lying anywhere below, far below actually 500,000 Kenya shillings. So we are saying to our public now that it's possible to do this in our public hospitals, and we are looking forward to what is happening in the modern world, whereby obesity is treated like any other disease. It is insured, it is funded by governments, and in our case, for example, NHIF should consider funding this type of operation, because we have many patients who would like to get this service, but we are not able to support them because they cannot afford. Yet it's possible that insurance can come in and consider supporting these patients like any other patient. So that's where we are, and that's why we consider this a special occasion for us. We got a patient who was weighing 176 kilos. 176 kilos. He had many other multiple problems. He really needed this surgery, and he could not afford private practice or private hospitals. We looked at ourselves and our facilities. Thank you very much, Bwana CEO, the administration of the hospital, for making it possible. The advantage we have in this country and in this hospital, specifically speaking, we have all disciplines that are required to take care of these patients. This is not a patient you're going to operate in a small facility as one consultant and you manage. You need big teams. And the big teams we are talking about, renal specialists like Dr. Ngigi here, were on board, and every specialty we are talking about had to participate at some point. We had cardiologists who had to assess this patient before and after. We had nutritionists who are on board. We have neurologists. We have psychiatrists. It's a multidisciplinary approach. And we had to discuss this patient very extensively and agree on the common points and way to go forward. And then, of course, we actualize the surgery. The surgery is not a big deal. This is minimal access surgery. Many of you maybe are aware of what minimal access surgery is. We go through small holes to do this operation on the abdomen. Kenyatta Hospital, we are lucky that this surgery is entrenched here, and many other surgeries we are able to do via small holes. So the big team discussed, came on board, prepared this patient, operated, and now they've taken care of the patient after the surgery, and we are going to follow up this patient even at his home. It's not a one-off affair. It's something you need to follow up even for longer times, because it's known at 3 years, if you are not following up this patient, and if he goes back to initial eating habits, this weight will start coming back. So we have also to take care of all this and many other areas of management of this patient. So that's what I have to say for now. The surgery was successful. The patient is alive. The patient is going home. Thank you.
Thank you very much. You've heard.
Hapa Kenyatta kwa sababu hii ndio hospitali ile kubwa hapa Kenya. Kutembea singeweza kutembea hata kidogo. Nilikuwa najaribu hata nikaenda karibu niende kwa waganga, lakini nilikuwa nimejaribu njia zingine.